Urine on the floor looks like a bladder problem. A cat avoiding a litter box looks like a behavior problem. A wobbly back end looks like just getting old. But across species, I see the same mistake over and over. We assume the problem lives where the symptom shows up, and that assumption can delay real care. I want to tell you a story about a dog named Bella. Bella was a 10-year-old Shih Tzu who came in for what looked pretty straightforward. She was urinating in the house. The other dogs were sniffing her privates a little bit more, and everything about the story pointed towards a urinary tract infection. On exam, Bella was calm and friendly. She had some little bit of muscle loss in her back legs, but at her age, that didn't immediately raise any alarms for me. We positioned her gently on her back to collect a sterile urine sample. She was relaxed and comfortable. And then, the moment the ultrasound probe touched her belly, before any needle, everything changed. Bella twisted a little bit and screamed, and she panicked. We stopped immediately, and when I gently pressed on her bladder, she screamed harder, and then she released a huge amount of urine all at once. As soon as she finished, the screaming stopped. That was the moment I paused, because I've seen this before. I see it in cats who stop using their litter box. The story often starts as behavioral. The cat is mad, the litter is wrong, the box is in the wrong place. But sometimes the real issue is pain when squatting. Nerve compression or discomfort is happening somewhere in the body. The litter box itself becomes associated with pain. I see it in rabbits too. A rabbit urinating outside its normal area is often assumed to have a bladder problem or a hygiene issue. But rabbits with spinal arthritis or early neurological disease may avoid positions that hurt. What looks like a urinary problem can be a mobility problem in disguise. Across dogs, cats, rabbits, and many other species, the surface behavior looks the same, but the cause underneath isn't. The pattern is this. We assume the problem lives where the symptom shows up. Urine on the rug must mean a bladder issue. Avoiding the litter box must be behavioral. Wobbliness? That means aging. But bodies don't work in neat little compartments like that. Pain in the spine can change how an animal urinates. Nerve dysfunction can affect posture, sensation, and control. The bladder is sometimes just the messenger, not the culprit. In Bella's case, the urine sample didn't show an infection, but her neurological exam told a different story. Her rear limb nerves were not functioning properly. Urinating hurt, not because of an infection, but because of what was happening in her back. It literally hurt to pee. Only after we talked more did the owners mention that Bella had been wobbly in the back end for almost a year. They thought it was just age. They didn't think it mattered. This is why it matters. When we look onto one explanation too early, we stop listening to the rest of the story. If Bella had been treated repeatedly for a UTI, she didn't have. Her pain would have continued. Her neurological disease would have progressed quietly. The real issue, the one affecting her quality of life, would have gone untreated. I see this delay across species. Cats labeled as inappropriate urinators, rabbits assumed to be messy, dogs treated again and again for infections they don't have, while spinal disease worsens in the background. This pattern has changed how I practice. I ask different questions now, not just where is the symptom, but what does this animal have to do with their body to perform this action? I pay closer attention to posture, mobility, and nerve function, even when the complaint seems localized. And when something feels too tidy too quickly, I pause. What I wish every pet owner understood is this. When your dog, cat, ferret, or rabbit urinates somewhere unexpected, they aren't being dramatic. They're communicating. They can't say, "It hurts when I arch my back." They can't explain that the litter box is associated with pain. They can only show you that something isn't right. Sometimes the most important question isn't what is happening, it's why now? And what had to change in the body for this to happen? Because the urine on the floor is often the last chapter of the story, not the first. And when we learn to read backwards from symptom to system, we start seeing the patient more clearly than the problem that first caught our eye. I remember Otis, a male cat that repeatedly urinated out of his box. His owner was beyond frustrated because she had done everything to fix the problem. She added litter boxes, she scooped them daily, she had his urine tested, it was normal. Finally, she had a dentistry performed under anesthesia. Crazy, right? A dentistry? Turns out Otis's problem was in his mouth. He had terrible dental disease and severely painful teeth. I fixed the teeth. I fixed the urinating out of the box. Your pet is communicating with you. Vets can help you listen. If you want to read this full essay, it's on Substack in my Lessons Across Species series. And if this way of thinking is helpful, subscribe here for more.